But I called you sir. In 2021, during the pandemic, a patient was brought to my office by taxi. She was accompanied by her sister, who reported that the patient had not seen a doctor in more than 2 years. She spent most of her time sitting in a chair at home. Following a thorough examination, we determined that the patient was bradycardic. She had slow heart rate, hypothermic, her temperature was low, and she had altered mental state. She was alert, but confused and somewhat slow. She also had a lot of fluid draining from her very edematous, swollen legs. I determined that she was severely hypothyroid and that she needed to go to the hospital for further and urgent treatment. I called the EMS system, and soon after, an ambulance arrived. There was a white male emergency medical technician accompanied by a white female. I then left the examination room with the two EMTs and went to my consultation room to see the next patient. After some time that elapsed, maybe a half an hour or more, I noted that they were still in the examination room. Staff what was going on, and they informed me that the EMTs had left the room. They had gone back to their ambulance. They brought up additional equipment, and they were doing an EKG and some other type of monitoring. I then entered the examination room and inquired what was delaying the transport. The male white emergency medical technician ordered me to leave the examination room. Somewhat perplexed, I reminded him that I was the doctor on the scene, and I had some input into what was going on. He then retorted, "But I called you sir." He then stomped out of the examination room, went into the waiting room where there were other patients, called his command, and I heard him say that there was a disruptive, uncooperative person on the scene. Soon after, another ambulance arrived with an individual who appeared to be a supervisor. After explaining the situation, the patient was taken to the hospital. Analysis. Why was it so difficult for this emergency medical technician to acknowledge that I was a doctor? Why did he retort, "But I called you sir," when doctor would have been more appropriate?